them with some of their products that they use in the lessons or that they serve to the children.
Okay, so what I'm going to do is I'm going to go over one of the studies that looked at the effectiveness of the short-term progress of the fresh fruit and vegetable programs. So how they went about conducting this study was that the researchers first instructed all the students on how to complete a food diary. So they stated what they had to write down every food that they ate. They wanted to know whether it was a snack, breakfast, lunch, or dinner, and all the condiments that came with it. And then along with that, they would go and they wanted to know if it was either consumed in school or out of school so that they could tell how the program was directly affecting and indirectly affecting their fruit and vegetable consumption. So what directly affecting means is that they actually ate the food inside the classroom, while indirectly affecting their fruit and vegetable program consumption, is what they ate outside of the classroom. And so after they put everything down on the food diary, the researchers would come in either a day or 2 days after, and they would conduct the 24-hour recall, and that's why it's called the diary-assisted recall system. And then the 10% of students follow-up interview, 10% of the students that they actually asked were then asked on a non-fresh fruit and vegetable program day to go in and do another 24-hour recall to see how the program affected their intakes on days where they weren't given food, fresh fruits and vegetables by the schools. Also, the students conducted interest surveys, and the interest surveys said how the students felt about what they were eating, what the foods were, what the overall program itself, how they felt about it, and just what fruits and vegetables that they liked the most. And they also received demographic information from the parents. Okay, and so this is the sampling methods that they used. So it was broken up into 4 different parts, and the first they chose 6 of the 48 continental United States, and they had 256 schools that actually were currently participating in the fresh fruit and vegetable program, and they had 128 schools that were directly above the cutoff for the schools to be participating, and 128 schools directly below the cutoff to be participating. But neither of those groups were actually participating in the study. And they chose middle school age children, so 4th, 5th, or 6th grade classrooms for each one, because they felt that those children would be better to actually conduct the diaries and be able to recall what they eat instead of the younger grades. And then the last regression step was that they asked 10 students from those classrooms to go and actually do the recalls and the diaries. And they interviewed only 8 in case there were absences or students not showing up. And of everyone that they asked, 74% actually completed them. Okay, and this is the demographic breakdown of the study. As you can see, that there are more females than males, and there was more 4th and 5th graders than there were 6th graders, and that Hispanic and non-Hispanic blacks were the majority of both groups. And this is just who was eligible for free lunch. You can tell that the majority of them were eligible for free lunch or reduced price lunches. Okay, so what they used to evaluate what the students actually ate was the USDA food and nutrient databases and the My Pyramid equivalent databases, because this was before My Plate came out. And what they were looking at was the fruit and vegetable cup equivalents, macronutrients, and the total calories consumed. Okay, so the results for this was that fresh fruit and vegetable students actually ate 1/3 of a cup more than non-participating schools. They ate 2.6 cups more of total fruit and vegetables, and 0.25 cups more of fresh fruits and vegetables. So you can see that the schools actually did serve fresh fruits and vegetables, and they weren't going into cans or anything. So they followed what the program was actually doing. However, one of the things that the researchers were hoping to accomplish was that they would have a decrease on total energy because fresh fruits and vegetables are less energy dense than the normal foods that these children are consuming. However, the desired effect was not there. And also they found that there was no statistical difference in demographics. But as you can see, the students consumed a third cup more per day total, and then 0.26 more total in school. So that means that it was only about a 0.07 increase in fresh fruits and vegetables outside of school. Alright, and this is just one of the graphs. It also had for total energy and intake out of school, but since the in-school one was the one that actually had a significant difference, I chose to put that one on here. And you can just see what the total numbers that they actually ate. And for a 10-year-old middle school age student, they want them to be eating about 5 cups of fruit and vegetables per day. And unfortunately, they're down to about 1.09. So they need about a 500% increase to get to where they want for the USDA's actual guidelines. However, a third of a cup is still a step in the right direction, and hopefully they can continue that. Okay, so now these are the limitations of the study. First is the obvious that they're doing it with middle school age children, and they might not remember what they ate or when they ate it. And one of the things that they actually found was that the majority of the students actually didn't eat any fruits and vegetables in school, but they found that 44% of the students actually did eat it, and the students that did eat it ate around 0.75 cups. So while there is a silver lining that the children who were positively affected were actually affected more so than the study was actually looking for, because they were fed about 0.5 cups per day. Short term, they really didn't have much time to do this study. They had 3 years, and as we said earlier in the presentation, each year the schools progressed in the amount of money that they were given. So the schools that got the very first one were at the very beginning of the study, in the beginning of the fresh fruit and vegetable program, and they do not know how the continued length of just having the fresh fruits and vegetable program would affect them. So maybe in the third year they would have had better results than in the first year because of more money and the students had more exposure to fresh fruits and vegetables. And that's what I meant by the lack of time allowed for the program to develop. And it was only reliable for the fresh fruit and vegetable program days where they actually received food, because the 10% food recalls that they did just wasn't enough. As you can see underneath, it says sample size, and the whole sample size was about 5,000 students total, and that only allowed them to have accuracy up to 47 calories and accuracy up to a 4th cup of fruit. So cutting that down to 10%, they really didn't have any accuracy to extrapolate a line and see how the fresh fruit and vegetable program actually affected their fruit and vegetable intake outside of the dates.
Okay, so now we're going to talk about the Child and Adult Care Food Program. So first I'm going to begin again with the legislation and a little bit about the program. So it was established in 1968. It was established to provide nutritious meals and snacks to eligible children who are enrolled in participating child care centers and family child care homes, after school programs, and homeless shelters. So in 1978, all public or private nonprofit institutions or sponsored facilities licensed or approved to care for children. So it was basically just expanded in 1978, and again in 1987. New amendments allowed for participation by selected adult care centers and in the child care food program. And it was also changed to the child and adult care food program. So before it was just for children basically, and now it's for children and adults. In 1987 was also when the elderly were added into the program. In 2010, the Hunger-Free Kids Act also expanded the program to what it is today. The mission statement for the program is that the Child and Adult Care Food Program provides aid to child and adult care institutions and family or group daycare homes for the provision of nutritious foods that contribute to the wellness, healthy growth, and development of young children and the health and wellness of older adults and chronically impaired disabled persons.
Okay, so I'm going to talk about the organizational structure. The Child and Adult Care Food Program is a federally funded program administered by each individual state. The USDA's Food and Nutrition Service administers the Child and Adult Care Food Program through state grants, and the program is administered within most states by the state's educational agency. And this is just a picture that shows kind of the breakdown how the funds are used. So the USDA federal funds go to individual state agencies, and then they're broken apart to all of the different care facilities, and then ultimately they go to the children and adults that use them.
As you can see, the Child and Adult Care Food Program has very similar administration to the Fresh Fruits and Vegetables program, so I'm not really going to go very much into this, but on the federal level, it's administered by the FNS. And then within most states, it's the state educational agency with a few exceptions. The only difference is that the child care component and the adult care component may be administered by differing agencies within a state. And I actually couldn't find any examples of that, but I did see that on the website, so I thought that I would add it in.
Okay, these are the goals and objectives for the Child and Adult Care Program. The overall goal is to improve and maintain the health and nutritional status of children and adults, promote development of good eating habits, and integrate nutritious food service with organized child and adult daycare services. And the objectives for the Child and Adult Care Food Program are different for each care center. So for the at-risk after-school care center, their objective is to give children and teenagers the nutrition they need and draw them into constructive activities that are safe, fun, and filled with opportunities for learning. For the adult daycare centers, their objectives are to give adults the nutrition they need as a routine part of their daycare program. And this Child and Adult Care Food Program reimbursements help lower the cost of serving meals at those centers that provide adult daycare services to meet the needs of functionally impaired adults. And these are some more. At child care centers, their objective is to provide nutritious meals and snacks to infants and children at a regular part of their daycare. At daycare homes, a daycare home is a daycare that is at a privately owned home, and their objective is to provide reimbursement for meals and snacks served to small groups of children receiving non-residential daycare in private homes that are licensed, registered, or approved to provide family child care. And lastly is emergency shelters, and their objectives are to help enhance the meal service the shelter provides to children and youth who are residents, and to give a